Okay, class. Tapusin na natin. Okay. Although some of the concepts were discussed already, i-review na lang natin para perfect na tayo dito sa cardiovascular disorders. We are done actually with the following discussion. Pero kailangan sumagot tayo para ma-review natin yung concepts natin. Sabi natin, all disorders with your cardiovascular disorders or related disorders, nag-start yan with coronary artery disease. Tama? Saan dyan yung related sa aging? Atherosclerosis or arteriosclerosis? Arteriosclerosis. Saan ang affected sa atherosclerosis? Tunica intima or tunica media? Diba? Perfect na tayo. Tunica intima. Okay, so nag-start yan with your coronary artery disease through atherosclerosis and arteriosclerosis. And affected would be several blood vessels in your body. If your coronary artery is affected, it could lead to angina and MI. Tama? If ang affected na part ay yung sa coronary artery, it will lead to your angina and your MI. But if the affected part ay doon sa may blood vessel, ay sa may brain, it would lead to CVA or stroke. Tama? CVA or stroke. Yun. Ay, record. Sige. I'll try my best to send ha. Mayroon full na yata ako. Pero sige, record natin. Okay. So hence, it all started with your coronary artery disease. Tandaan natin yung disruption. There is disruption in the blood flow. Not myometrium, ha? Hindi siya sa myometrium. The blood flow of blood in the myocardium. Myocardium yun. Because of the disruption of blood in your coronary artery, leading to your MI or your angina. Hence, you know already your atherosclerosis, nasabi na natin yan. You know already your statins, ang statin natin. When are you going to give your statins? Evening. Because cholesterol synthesis happens at night and because of the effect of your rhabdomyolysis. So the cause of that is an increase in your cholesterol or your lipid profile. To diagnose that, alam mo na, to check for the obstruction, you have your cardiac catheter, yung exact location niya. And you also use a dye to know the exact location. Okay, treatment mo, syempre, low-fat diet, and of course, your anti-lipidemics. Ano yung isa yung bawal i-combine with any other drugs because of most of the drugs are fat-soluble. Anong gamot yun? Bile acid sequestrant or bile acid sequestrant. Okay, pwede rin gamitin yan as your medication. Next, we move on to your number one, okay, na tinatanong doon sa board exam natin because this is the number one cause of death among Filipinos, hypertension. Okay? So you have your cardiovascular disorder, number one cause of death is hypertension. And because of hypertension, ang number one na mangyayari na complication na cause of death ay stroke or your cerebrovascular accident, your CVA. Nasabi ko na ba yung bagong classification ng hypertension? Yes! Dahil na yun yung AHA? Yes! Okay. Alam na rin yung medications na ginagamit natin for hypertension? Yes, yung ating, anong first na drug natin for hypertension management? Diuretic na thiazide. Ang next natin doon ay ACE inhibitor or your angiotensin 2 blockers. Anong diet ng pasyente na titik ng ACE inhibitor? Sagot? Low potassium or high potassium? Low potassium. Kasi walang release ng aldosterone. And of course, yung number 3, yung dalawang action, decrease contraction ni myocardium at decrease ang constriction ni blood vessel. Calcium channel blocker. Pag meron akong dosage na 25 at 5, nasaan doon ang calcium channel blocker? 5. Okay, good. Alam na natin. Now, additional information for your hypertension, it could be considered as primary or your idiopathic. Okay? Pag sinabing idiopathic, related ito sa stress. Pag stress, anong ma-activate? SNS or PNS? SNS. And as a result of your sympathetic nervous system stimulation, magkakaroon tayo ng hypertension. Primary, essential, and idiopathic, and that is related to stress. Okay, related to stress. Secondary hypertension, related yan sa renal disease. Renal disease, meron tayong fluid retention. Fluid retention, increased blood volume, increased cardiac output, and therefore increasing blood pressure. Diba meron tayong oliguria. Okay, endocrine disorder like diabetes mellitus. Diabetes mellitus, hyperglycemia, viscous ang blood natin. Pag viscous ang blood, may injury sa lining ng blood vessel, resulting to atherosclerosis, therefore increasing your blood pressure. Hyperthyroidism, ano yung problema sa hyperthyroidism? Increase ang metabolism, increase T3 and T4, resulting to increase in your blood pressure. Another, pheochromocytoma. Ano yung pheochromocytoma? Pheochromocytoma is a tumor in your medulla, adrenal medulla, not medulla oblongata ha. In your adrenal medulla. Your adrenal medulla produces your epinephrine and norepinephrine. If there is an increased epinephrine and norepinephrine, increase ang blood pressure. So pheochromocytoma is a tumor in your adrenal medulla. Tumor in your adrenal medulla resulting to increased epinephrine and norepinephrine, increased SNS, increased hypertension. Ano yung bawal? Ano yung test natin for pheochromocytoma? Test for pheochromocytoma. Vanillyl mandelic acid test. Vanillyl mandelic acid test, or that is your VMA. Test for pheochromocytoma. Pheochromocytoma, there is a tumor in your adrenal medulla, resulting to increased epinephrine and norepinephrine, resulting to SNS signs and symptoms, including hypertension. To check for pheochromocytoma, meron tayong diagnosis, ang tawag vanillyl mandelic acid test or VMA test. Before the test, bawal ang food that contains vanilla. Any food that contains vanilla. Before the test, bawal any food containing vanilla. Example, yung chocolate. Okay, bawal yan. So, any foods containing vanilla, bawal yan before vanillyl mandelic acid test. So, kung sinabi kong pheochromocytoma, pwede ba akong gumamit ng beta blocker na gamot as a management for the signs and symptoms? Yes or no? Oh. Ulitin ko. Pheochromocytoma is a tumor in your adrenal medulla resulting to increased epinephrine and norepinephrine equals SNS. So, ang signs and symptoms niya ay SNS. So, gagamit ba ako? Pwede ba akong gumamit pag may pheochromocytoma ng beta blocker na propanolol? Yes or no? Yes or no? Yes. Kasi nga ang symptom niya probably ay tachycardia. Kasi nga ang symptoms ay SNS. Pwede ba akong gumamit ng hydralazine na vasodilator? Yes, kasi merong hypertension. Pag may pheochromocytoma ba, i-check ko ang glucose level? Kasi pwede magkaroon ng hyperglycemia? Yes, kasi nga ang effect niya ay SNS. So, hindi ka na naman magme-memorize ng signs and symptoms ng pheochromocytoma kasi naintindihan mo na ang SNS at saka yung parasympathetic. If you remember that, okay, pag alam mo na yung effect niyan, hindi ka na magme-memorize ng signs and symptoms or even the medication. Okay. Next, so secondary hypertension, meron siyang underlying disease. Example mo, renal disease, endocrine, na hyperthyroidism, and your nawala pala pag ano. And your pheochromocytoma. Okay, now theories Alam na natin to, class. No need to read na and memorize. Alam mo na kasi yung RAAS, di ba?
Yes.
Alam mo na yung RAAS. Alam mo na rin yung thickening, yung atheroma, di ba? Alam mo na rin yan. Alam mo na rin yung peripheral resistance. It's the degree of constriction and dilation. May vasoconstriction kung merong SNS, stimulation. So no need to memorize this kasi alam mo na rin ito. Pag increase ang blood volume, alam mo na increase ang cardiac output, ang alam mo na mag-increase ang blood pressure. So you know already the theories behind your hypertension. Okay, alam mo na rin to, thyroid, hyperthyroidism. Sir, ano to? Pituitary gland. Kung meron kang tumor sa pituitary gland, pwedeng mag-result yan to hypertension. Why? Bakit kung merong tumor sa pituitary gland could lead to hypertension? Because of your stimulating hormones. Pituitary gland will stimulate yung ating hypothalamus. Si hypothalamus mag-release ng stimulating hormone, like for example, adrenocorticotropic hormone that would stimulate your adrenal cortex. Okay, that would release aldosterone equals sodium and fluid retention equals hypertension. So yes, kung meron kang pituitary gland tumor could lead to hypertension. Nakuha natin. So ano yun? Primary or secondary? Secondary. Nakuha natin. So pituitary gland tumor, it could also result to your hypertension. Ano naman yung coarctation of aorta? This is a defect, di ba? Pediatric concept. There is coarctation of aorta. So kung may coarctation of aorta, meron tayong compression, backflow ng blood natin, increasing blood pressure. But the blood pressure sa may coarctation of aorta, saan lang mataas ang blood pressure? Sa may upper extremities, di ba? Sa coarctation of aorta, nasa ang hypertension? Sa upper extremities. Pero pag binipin mo sa baba, sa lower extremities, mababa ang blood pressure. Coarctation of aorta. Diba? Sa bata, coarctation of aorta, increased blood pressure on the upper extremities, but decreased blood pressure on lower extremities because of the coarctation of your aorta. Meron pa yung isa, yung transposition of great veins. Diba? Of your great blood vessels. TOCA. Diba? Saan yun? Sa pediatric nursing din yun. Okay, pregnancy. Ano naman yung mangyayari sa pregnancy? Bakit mayroong hypertension? Pregnancy-induced hypertension. Pregnancy-induced hypertension leading to your eclampsia. Leading to your eclampsia. Bakit nagkaroon ng hypertension doon sa pregnancy? Ha? Bakit kaya meron tayong increased blood pressure, pagbuntis, PIH, pregnancy-induced hypertension? Bakit kaya? Ano yun yung makikita sa urine? Merong albuminuria leading to fluid retention. Kasi decrease ang oncotic pressure leading to increased blood volume, leading to increased blood pressure. Diba? Meron tayong albuminuria sa pregnancy-induced hypertension. Ano yung ginagamit mo to test for the albumin na meron makikita mo sa may CHN bag mo? Ano yung ginagamit mong solution to check for the presence of protein in the urine? Diba nag-community health nursing? Diba magbahay-bahay ka doon? Eh may buntis na nanay. One of your assessment is to check for the presence of protein in the urine. So that as early as possible, mamamanage mo na, ma-refer mo si nanay na hindi siya pwedeng manganak doon sa RHU. Na dapat manganak siya doon sa hospital. Ano yung test na ginagawa mo na meron sa inyong CHN bag? Acetic acid test. Di ba meron kang acetic acid sa CHN bag? Meron? Parang hindi chinek yung laman ng CHN bag, pinang-picture lang. Diba? Chinek nyo ba yung acetic acid? Di ba meron acetic acid doon? Acetic acid. So, paano gawin ang acetic acid test to check for the protein? Meron kasi isang solution doon, si Benedict solution. Di ba? Nakita yon? Si Benedict solution. Dalawa yon, si acetic acid at saka si Benedict solution. Si acetic acid ginagamit yan to check for the presence of protein in the urine of the mother. Because as early as possible, if there is a pregnant mother in the community at nagbahay-bahay kayo, pwede mo na agad-agad ma-screen kung meron siyang PIH by checking the presence of the urine checking the presence of protein in the urine. So acetic acid test, di ba meron kang test tube sa oxidation bag? O para saan yung test tube? Ayun pala yun. Sa test tube, doon mo ilalagay si urine. Di ba meron ka pang lamp?
Yes, sir.
Para saan pag brown out, hindi para sa brown out yun. Kasi mga test tube holder. Di punta ka sa bahay. Si nanay na buntis, kolekta ka ng urine. Si urine ilalagay mo sa test tube. Ngayon, yung test tube, pupunuin mo yun at least 2/4 ng urine sa test tube. Sasilbihan ngayon si lamp. Okay? Iinit mo si urine doon sa lamp. Pag mainit na, yung urine, aalisin mo doon sa may lamp. Papatakan mo ngayon ng 2 to 3 drops ng acetic acid solution. Ngayon, isa-shake mo siya. Okay? Ngayon, malalaman mong may protein yung urine niya if the urine becomes turbid. Malalaman mong merong protein if the urine becomes turbid or cloudy. Okay? Malalaman mong merong protein kung yung pinatakan mo na mainit na ihins na nasa test tube, okay, may protein if it's turbid or cloudy. Class, huwag patakan ng acetic acid habang iniinit mo, ha? Acetic acid, nasabog yun, explosive. Paano kung di mo na alam, hindi ko na sinabi, di wala na. Sabihin sila, dyan ko lang ng acetic acid, alisin mo na doon sa lamp, hindi mo nang i-hit. Pagkaalis, saka mo siya papatakan ng 2 to 3 drops ng acetic acid. If it turns cloudy or turbid, ibig sabihin may protein. Bibigyan sa kausapin mo na ngayon si nanay. Nanay, kailangan mo magpa-check up. Okay? Para ma-screen talaga kung meron kang PIH. Kasi kung may PIH, hindi siya pwedeng manganak doon sa RHU. Kailangan sa hospital. Comprehensive. Semong at saka yung demo natin, di ba? May demo basic emergency. Sa demo, hindi ka pwedeng manganak kung sa demo pang RHU lang. Hindi ka pwedeng manganak kung meron kang PIH. Ano pa? Hindi pwedeng manganak kung yung presentation ay hindi siya cephalic. Di ba? So yun. Next, may Benedict solution. Sa Benedict solution naman, okay, ganun din. Test tube, kuha ka ng ihe. I-hit mo ulit si ihe. Then, alisin doon, then papatakan mo ulit ng Benedict solution. Okay? If the urine turns orange to red, pag naging orange to red, ibig sabihin merong glucose naman. Benedict solution to check for the presence of glucose in the urine. Kung naging red at saka orange, nako, gestational diabetes. Hindi ulit pwede manganak sa RHU. Refer mo agad na naman yan sa hospital. Pero pag blue, green, yung naging kulay ng ihi, after mo ipatak si Benedict solution, walang glucose. So walang gestational diabetes. Kapag green-blue, wala. Kung orange to red, may glucose. May glucose. Gestational diabetes. Yan yung purpose ng ating acetic at Benedict's at lamp at test tube. At test tube holder sa CHN bag. Ngayon ko lang nalaman, sir. Kala ko namin, sir, pang ano lang to, pang wala lang. Pang may gagawin yun. So nag-interview ba kayo ng buntis na nanay noon sa community? Bakit hindi nyo ginawa? Part ng assessment yun.
Sir, paano
Spirit of ammonia, pag nahimatay naman yun. Stimulant, pag-stimulate yun. No? Himatay, pag-stimulate yung spirit of ammonia. E pag in-stimulate mo at hindi nagising, baka may case, it's either hyperglycemia or hypoglycemia yung pasyente natin. To increase blood supply kasi yun to the brain. O pag na-increase sa blood supply, di malipungatan siya, diba? O, spirit of ammonia. E saan mo ilalagay yung mga solution sa CHN bag? May proper arrangement yun. Saan mo ilalagay? O, ito yung clue. Ito yung clue. Okay. Lahat ng nako-fold. Alam mo yung mga nako-fold? Paper bag. Not paper bag. Paper lining. Plastic lining. Apron. Gloves. Lahat ng nako-fold, sa top mo ilalagay. Lahat ng nako-fold, sa top ilalagay. Di ba dun sa station, bago meron yung garter sa harapan?
Yes.
Lahat ng nababasag at lahat ng patayo. Ano yung patayo? Thermometer, scissors, ano pa? Test tube holder. Lahat ng nababasag at patayo doon sa may garterize mo ilalagay. O ha? Next, lahat ng solution, alcohol, acetic acid, Benedict's, lahat ng solution sa likod, rare part mo ilalagay sa likod. Lahat ng hindi ko na nabanggit, sa gitna mo ilalagay. Ano yun? Soap dish with a soap. Yung cotton ball na may lagayan at cotton balls na dry and the wet, doon sa gitna. Lahat ng hindi ko nabanggit sa gitna, ilalagay. Solution sa likod. Nababasag pa tayo sa harapan na may garterize. Lahat ng nako-fold sa top, ilalagay. Diba? Yung BPF na sa loob pa ng CHN bag, it's carried separately. Okay, that's for your acetic acid test and your Benedict solution. Okay, ano yung pag may poor beat at cloudy, ano ibig sabihin? Merong may protein, PIH. Okay. Benedict solution to check for the presence of glucose in the urine. Anong color pag may glucose? Orange to red. Orange to red. Okay.
Sir,
Yes. Sorry. Excited mo din. Okay. Symptoms. Your hypertension is usually asymptomatic. It's usually asymptomatic. But remember, ito yung ating symptoms. Presence of neck pain, the presence of neck pain, and of course, palpitation. The complication of your hypertension, the cardiomyopathy. Diba? Complication niya is cardiomyopathy. Kakapal yung lining doon sa ating heart, but that doesn't mean na increase ang contraction. Kahit pumapal, nagkaroon ng cardiomyopathy, decrease ang cardiac output because of decreased pumping ability of your myocardium. Pumapal yan dahil yan ang compensation ni myocardium mo or yung lining ng heart mo because of the increase in your blood pressure. Okay, alam na natin yan. Complication, left ventricular, ito na yung cardiomyopathy, left ventricular hypertrophy. Left ventricular hypertrophy because of the increased pressure. Kung may hypertrophy in decrease, kahit pumapal, pero decrease ang pumping ability, magkakaroon ka na ng congestive heart failure. Ineffective ang pumping ability ni myocardium kahit pumapal, cardiomyopathy. Aneurysm, pwedeng MI, infarction. Ano yung isa yung dito, yung bawal mo ipalpate? Abdominal aortic aneurysm. So ang ating goal to prevent aneurysm is we need to control hypertension. Can you stop taking your antihypertensive drug? Hindi pwede magkaroon ng rebound hypertension. So to control aneurysm, kailangan natin i-control ang ating blood pressure. By giving the medication, even the BP is normal. We cannot skip, we cannot stop. Okay, CVA, alam mo na yan, ito yung number 1 cause of death, di ba? Number 1 cause of death na merong hypertension. Okay, eyes, pwede magkaroon ng hemorrhage, retinal hemorrhage. pwede mong matest yan through your fundoscopy. Okay, sa fundoscopy. Sa fundoscopy, meron ang normal dyan, meron ka makikitang red reflex. Okay, fundoscopy, meron ka makikitang red reflex. However, kung nagkaroon ng retinal hemorrhage, hindi mo makikita ang red reflex, color dark na black ang makikita mo doon sa retina. Ibig sabihin, nagkaroon ng aneurysm of the small blood vessels sa retina. So you could use fundoscopy to check for the presence of red reflex. Yung red reflex, makikita mo yan doon sa retina. Kung may red reflex, ibig sabihin, okay ang small blood vessels. Pero kung black at wala yung red reflex, ibig sabihin nagkaroon ng aneurysm. Pumutok yung ugat na maliliit doon sa may retina. Retinal hemorrhage. Okay, retinal hemorrhage. And of course, because of the increased pressure, okay, maapektuhan din yung ating kidney. Hypertension could result to kidney failure, and vice versa. Kidney failure could result to hypertension. Nasabi ko na last time, di ba? Okay. So that's for your hypertension. You know already your management. Ito ay modifiable natin. Exercise, low sodium, low fat diet, and you know already your anti-hypertensive medication. Tama?
Yes.
Pero kung merong CHF na yung pasyente at may hypertension, bibigyan mo ba ng beta blocker? No. Kasi pag bibigyan mo ng beta blocker, lalo mag-decrease ang cardiac output. Kaya hindi siya kasama doon sa protocol na drugs na according to your AHA. Tatlo lang yun. Thiazide na diuretic, ACE, ARBs, and calcium channel blocker. Kasi most common complication of hypertension is congestive heart failure. Okay. Okay, angina na pala to, NMI. Okay. Konti na lang. Angina MI, na-lecture na yata natin last time on angina and MI. Pag sinabi mong angina, there is a problem on the O2 demand and supply. Okay? Meron tayong problema on the O2 demand and supply of your body. Primarily, si myocardium. Primarily, your myocardium. Sir, why is there an why there is an imbalance on O2 demand and supply? Because of your coronary artery disease. Decreasing blood supply to your myocardium through your coronary artery. Pero yung angina natin, meron tayong types of your angina. Okay, meron pang types of angina. Number 1, yung stable na angina. Okay, stable angina. Stable angina, mawawala ang pain if you rest. Okay? The pain here in your stable angina will be relieved through rest. Kung nag-rest ka, mawawala si chest pain. And you know already the pathophysiology of chest pain. Instead na aerobic respiration, anaerobic production of lactic acid equals pain. Pag nag-rest ka, nag-stop ka sa ginagawa mo, mawawala ang pain. So, ang una mong intervention, if there is angina, is you let the patient stop what he or she is doing. Ngayon, pag hindi na-relieve yan, nako, baka unstable angina na yan. Unstable angina, it can only be relieved through your NTG, your nitroglycerin or your nitrates. Discuss ko mamaya yung nitrates natin. Number 3, yung Prince metal. Okay, Prince metal angina. Prince metal angina, it's not because of the atherosclerosis, it's because of a vasospasm. Okay? Ang cause ng Prince metal ay vasospasm of the coronary artery. Okay? Ang Prince metal angina, the cause of that, it's not atherosclerosis, but a vasospasm of the coronary artery. Number 4, meron tayong tinatawag na post-necrotic angina or yung tinatawag mong post-MI angina. Nagkaroon ka ng chest pain after mo ma-diagnose or nagkaroon ng MI. Post-MI or post-necrotic angina. Nagkaroon ng chest pain after mo nagkaroon ng MI. Okay? Now, for your angina, syempre ang unang gagawin natin, sabi natin, stop what you are doing. Rest. Pero kung wala, pero pag hindi na-relieve ang chest pain mo, anong gagamitin natin? Your nitrates. Dahil na tayo sa nitrates, na-discuss na? Hindi pa. Okay, good. Now, nitrates, ito yung drug of choice for angina. Drug of choice for angina. Ang nitrates, ano ang ginagawa niyan? It relaxes, okay? It relaxes the smooth muscles, of the blood vessels. Nirelax niya yung smooth muscles of blood vessels. Therefore, promoting vasodilation. Una, vasodilation of the coronary artery. Alright? Una, vasodilation of the coronary artery to increase blood supply in your myocardium. But remember, the effect of nitrates is what? Systematic. So magkakaroon ka rin ng vasodilation of all your blood vessels. Kung nag-dilate yung blood vessels mo, anong mangyayari sa venous return? Anong mangyayari sa venous return? Decrease ang venous return. Gusto ba natin ng decreased venous return? Sa pasyenteng may angina, gusto ba natin ng decreased venous return sa pasyenteng may angina? Yes or no? The answer is? Ulit. Angina, may atherosclerosis, arteriosclerosis sa coronary artery. Decreased blood supply sa myocardium. Myocardium, nahirapan ngayon mag-pump ng blood dahil decrease ang blood supply. Ngayon, gusto mo bang i-increase ang venous return or decrease? Decrease. Para hindi mahirapan si myocardium. I-decrease mo ang venous return. Kasi you want to decrease the cardiac workload. Diba? So, dalawa ang ginagawa ni nitrates. Dinadilate kasi coronary artery to increase blood supply sa myocardium. And number 2, because of vasodilation, decrease ngayon ang venous return. Pag decrease ang venous return, decrease ang cardiac workload. So, hindi nahirapan si myocardium. Nakuha natin yung purpose ng nitrates natin. So, dalawa ang purpose niya. It dilates the coronary artery to increase blood supply. Number 2, it decreases venous return to decrease the cardiac workload. Kasi di ba nga, nahirapan si myocardium, di ba nga ang problema mo yung blood supply sa may myocardium. Okay, that's for your nitrates. Now, your nitrates class, pwedeng ibigay yan ng NTG pill. Di ba? Pwedeng NTG pill. Sa NTG pill, magbibigay ka ng 1, 2, at saka 3 pill. Maximum of 3 pills. Pagkabigay mo ng first na pill, maghihintay ka ng 5 minutes. Hindi na wala, ibibigay yung pangalawang pill. Pagkabigay ng pangalawang pill, maghihintay ka ulit ng 5 minutes. Hintay ka ulit ng 5 minutes. Pag hindi na wala, ibigay yung pangatlong pill. However, pagkabigay ng pangatlong pill, anong gagawin na at hindi na wala ang chest pain? Baka nga myocardial infarction na. Kung pagkabigay ng pangatlong pill at hindi na wala, anong gagawin na? Ipupunta na yung pasyente saan? ER. Punta na sa ER. Kasi baka MI na. Anong unahin natin? Morphine, oxygen, position the patient, high Fowler's position. Anong sinabi natin? Anong unahin natin? Anong unahin yung gagawin? Pagkapunta sa ER, the initial intervention of the nurse is to A, give morphine, B, give oxygen, C, position the patient High Fowler. Letter D, give antiplatelet medication. A, B, C, D. The answer, class, is morphine sulfate. Give morphine sulfate. Sir, para saan ang morphine sulfate? Morphine sulfate, yes, that is for the pain. Pero secondary lang yan. Ang purpose ng morphine natin is to decrease the O2 demand of the body. Exact question sa board exam. To decrease the O2 demand of the body. Secondary na lang ang morphine ay para saan? Chest pain. Secondary na lang ay sa chest pain. So, ang unang gagawin, pagkabigay ng third pill at hindi nawala ang chest pain ER, bigay mo na ang morphine sulfate. Sir, bakit? To decrease the O2 demand of the body. Kasi mataas ang O2 demand of the body kasi nagkaroon na ng infarction. Ibig sabihin, wala nang supply sa may myocardium. Wala nang supply sa may myocardium, decrease na ang cardiac output. So, mataas ang O2 demand ng buong katawan. Eh kung bibigyan mo agad-agad yan ng oxygen or ipoposition mo, walang silbi. Kasi bakit? Mataas pa ang O2 demand ng katawan. Kailangan mo muna isuppress ang O2 demand ng katawan by giving morphine sulfate by depressing your medulla oblongata. Nakuha natin. So, bibigyan ng morphine to decrease the O2 demand of the body, secondary for the pain because it's a narcotic, analgesic. Anong next mo gagawin doon? Oxygen, and then next mo siyang ipoposition, then pwede mo bigyan ng antiplatelet medication. That's the proper management sa pasyente nagkaroon ng MI. Nakuha natin.
Yes, sir.
Nag-gets na yun, class? So, ano unang gagawin? Pagkadala sa ER? Agad-agad position, patay ang pasyente nyo agad, class. That's na. Ang taas na ng auto demand, walang silbi yung positioning mo kasi mataas ang auto demand. Diba? Patay agad, cardiac arrest agad yun. Diba? Okay. Ngayon, yung NTG pill, you need to store that on a brown bottle. Kailangan nakalagay ang pill sa brown bottle because your NTG pill is easily inactivated by light. Okay? You need to store your NTG pill sa brown bottle. Lagay mo dyan, NTG pill, brown bottle, store, ganun lang. Store your NTG pill sa brown bottle because NTG pill is easily inactivated by light. Another, ang NTG pill mo, pagkalagay mo sa sublingual, saan ang sublingual? Under the tongue. Kasi bakit dyan? May mga blood vessel dyan for easy absorption. Pagkalagay sa sublingual ang NTG pill, normal lang ang merong tingling sensation or a warm sensation. Ibig sabihin, normal lang yun. Ibig sabihin, si NTG pill mo ay hindi expired. Hindi expired. Ilang months lang ba ang itatagal ni NTG pill? Up to 6 months lang yan. Hindi na yan pwede umabot up to 1 year. Okay? So, kailangan lagi mo i-check yung date of production. Eh baka expired na yan at biglang nagka-angina yung pasyente, kaya pala hindi nawawala ang chest pain kasi expired na. Up to 6 months lang, class, ang itatagal ng NTG pill natin. You store that on a dry place, on a brown bottle, because it is easily inactivated by light. Okay. Ngayon, ang NTG mo pwedeng NTG patch. NTG patch. Transdermal patch. So, pwedeng NTG patch or transdermal patch. Pag transdermal patch ang NTG mo, si nurse kailangan gumamit ng gloves para ilagay yung NTG. Because nitrates are easily absorbed by the skin. Nitrates are easily absorbed by the skin. Instead na yung pasyente ang nagkaka-side effect, eh baka si nurse na tatanga-tanga ang nagka-side effect. Kasi hindi siya gumamit ng gloves nung nilagay niya yung transdermal patch. Diba? Ano yung side effect ng ating NTG since may vasodilation? Hypotension. So, side effect ng gamot ay hypotension. Anong mangyayari ulit sa venous return? Decrease or increase? Pag decrease ang venous return, anong organ ang sensitive sa decreased blood supply? Ha? Brain. So side effect niya ay dizziness, headache, vomiting, confusion because of decreased venous return. Hypotension plus neurologic signs, headache, dizziness, confusion. So kailangan gumamit ng gloves, baka magkaroon ng hypotension si nurse na tanga-tanga-tanga. Kasi gumamit ng gloves. Okay, siya nag-absorb ng weights, di ba? Okay. Now, pag gumamit ng transdermal patch, you have to rotate the site. O, sulat yun, rotate the site. Nabasa na ang buong Brunner's and Sutar. Okay, transdermal patch, you need to rotate the site. Okay? So, kung nilagay dito, nung last, dito naman sa kabila, pwedeng anterior and posterior chest wall. But you need to rotate the site. Another, pwede rin kasi ang NTG mo na pace. NTG pace. Okay, pwedeng NTG pace yan. Pag gumamit ka ng NTG pace, you have to remove the previously applied pace before you put another pace. Kung hairy ang chest ng pasyente, ano gagawin? Clip mo muna. Clip, non-invasive, clip. Pero kung hindi kaya ng clip yan, pwede ng shave. So, ang sagot doon, i-clip mo muna. Pag di kaya ng clip, shave mo na kung talagang sobrang hairy. Okay? So, pwedeng NTG paste. Pwede rin NTG IV. Okay? Ay, sorry. Pwedeng NTG IV. Pwedeng NTG IV rin. NTG IV, ito yung ating isosorbal. Isosorbal. Okay? Pwedeng IV na NTG yan, yung ating isosorbide or yung ating, nitropuracide. Ito na lang class, wala yung isosorbide. Nitropuracide. Nitropuracide. Yan yung kalamitang ginagamit kasi, yung nitropuracide. IV na NTG. So ulit, chest pain sa angina, ang kanyang radiation dito lang sa harapan. Pero pag severe yan at MI, kahit sa likod, aabot ang chest pain. Ang chest pain sa MI, ang description niya ay crashing. Okay? Crashing and feeling dumbness. Pero pag sa angina kasi, stabbing pain. Parang stab. So mas malala yung pain saan? MI. Okay. So yung radiation ng MI aabot hanggang sa likod. Pero yung sa angina, dito lang yan sa harapan at saka sa shoulder area. Okay? Ano yung ating sign doon sa MI? Levin sign. Yung nakilataas ang kamay letter L, that is Levin sign. Okay? Yung ating sign for your MI. Nagbigay ako ng NTG pill. Ilang pill ang kailangan ibigay? Sagot? Maximum of how many pills? 3. Nagbigay ako ng first pill. Ilang minutes ang hihintayin? 5. Hindi nawala ang pain. Magbibigay ako ng? 7. Ilang minutes ang hihintayin ulit? 5. Hindi nawala, bibigyan ng? Third. Magbigay ng third at hindi nawala, anong gagawin? Ano unang gagawin? Morphine. Morphine to decrease the demand of the body. Secondary yung para saan? Para chest. Para sa chest pain. Okay, that's for your angina and MI. Ano yung ginagamit nating another management na it promotes revascularization by inserting a catheter. Tapos mag-i-inflate ng balloon. Percutaneous or transcutaneous balloon angioplasty. Para hindi ulit magkaroon ng blockage, anong ilalagay mo? Stent. Okay. Ngayon, wala nang pag-asa, hindi na madadala ng stent at balloon angioplasty. Anong gagawin na natin? Cabbage, coronary artery bypass graft. Anong ginagamit nating vein doon? Sa venous vein at saka yung internal mammary artery. Internal mammary artery. yung sa pills din, i-connect yun from your aorta. Sa aorta yun galing, hang papunta doon sa may myocardium. Yun yung grafting natin. So, cabbage, ginagawa both MI and angina. Pwede bang bigyan angina ng anticoagulant? Yes or no? Pwede bang bigyan ng angina ng anticoagulant? Yes, kasi nga ang cause niya ay thrombus or an embolus. Okay? Pwede bigyan ng anticoagulant. Diba? Pwede bigyan ng anticoagulant. Okay, that's for your MI and your angina. Nakastore ba sa brown bottle yung pill? Yes! Because it is easily inactivated by? Ilang months ang expiration? Ilang months? 6 months. Normal ba may tingling sensation paglagay sa blood? Ha? Yes! Swan Guns catheter, PAP or CBP? PAP or CBP? PAP. P right side or left side? Ha? Right side. Okay, right side. Increase more than 12. Ano ibig sabihin? Hyper or hypovolemia? Ha? Hypervolemia. Test for protein in the urine. Acetic or Benedict? Acetic. Colorless after dropping the acetic acid. Ano ibig sabihin? May protein o wala? Kailangan or cloudy. Pagkalagay ko ng Benedict's color green, may glucose wala. Kailangan ng color? Orange and? Tumor doon sa may adrenal medulla. Anong sakit? Pheochromocytoma. Ang simptomas ba ay SNS? Pag sinabi ng SNS, may hypertension? May tachycardia? May pheochromocytoma, bibigyan ko ng propanolol? May pheochromocytoma, bibigyan ko ng propanolol? Yes, kasi ang simptomas na ay SNS at merong tachy. Hyperthyroidism, ano mangyari sa blood pressure? Ha? Hypertension. Gagamit ako ng NTG patch, gagamit ba ako ng blood? Yes or no? Yes! May normal ba may tingling sensation pagkabigyan ng NTG pill? Yes! Makasabay yun ko, heparin and coumadin. Yes! Heparin and aspirin. No! Yung trampoline is effective pa ba more than 8 hours? No! Yes or no? No! Kailan ibibigay ang simvastatin na gamot? Evening, AM? Evening! Sagot? Evening! Evening. Pagkabigay ko ng third na pill, NTG pill, hindi nawala ang chest pain, anong gagawin? Ano ko nang bibigay? Morphine! Sagot? Morphine. So, kailan ako mag-stop mag-take ng heparin while taking both heparin and coumadin? Therapeutic level ng PTT or PT? PT, prothrombin type. Nag-take ako ng coumadin, pwede ba ang green leafy vegetable? No! Yes or no? No! Pag-test ako for pheochromocytoma, pwede ba ang vanilla containing food? Hindi pwede, hindi pwede. Drug of choice ng syphilis. Sagot? Penicillin. Assessment ko before ako mag-arteriography at gagamit ako ng dye. Before. Yung anong assessment ko? Creatinine at saka kung meron siyang allergy sa shellfish. At kung merong allergy siya, shellfish. Eh yung intervention ko after increase oral fluid intake. Eh magka-transesophageal echocardiogram ako. Ano yung intervention ko after? Kasi gumamit ako ng pang-paralyze sa gag reflex. Kailangan naka-NPO. Kailangan naka-NPO. Yung tawag natin doon sa ECG monitoring na 24 hours to check for cardiac arrhythmia. Ano yun? Holter monitor. Yung check ko yung presence ng chest pain. Ano yun? Stress test. Ano yung unang-unang diagnostic procedure na ginagawa natin pag may cardiovascular problem? ECG! Sagot? ECG. Eh, meron nakang presence of U wave sa ECG. Ano kaya yun? Ano? Hypokalemia. True or false? Urine output is a reflection of cardiac output. True or false? True. Gagamit ako ng Swan Guns catheter, CVP, PAP. Sagot? PAP. Nagbibigay ako ng Alteplase, but beyond 6 hours, effective pa kaya? Ha? The answer is no. Okay, the answer is no. Ngayon, recently, I was diagnosed with MI. Recently, I was diagnosed with MI. And now, I am experiencing chest pain. Now, I am experiencing chest pain. The initial intervention of the nurse is letter A, give morphine. B, give oxygen. C, give NTG. Letter D, give antiplatelet medication. Recently, I was diagnosed with MI and now I am experiencing chest pain. The initial intervention of the nurse is A, morphine, B, oxygen, C, NTG. Letter D, antiplatelet medication. Sagot? Answer? Recently, I was diagnosed with MI. Now, I am experiencing chest pain. The initial intervention of the nurse is A, morphine, B, oxygen, C, NTG, D, antiplatelet medication. The correct answer is letter C. Letter C. Nakalimutan yung types ng MI. Stable, unstable, principal, and post-MI angina. Recently was past tense, diagnosed ED. So, meron na akong MI, nagka-chest pain ako. Probably yung chest pain mo ay a post-angina, post-MI angina. So, sagot mo ay NTG. Exact question sa board exam. Exact question natin sa board exam. Nakuha. O kaya, dapat talaga yung explanation, intindihin yung disease process. Okay? Gusto ba natin ng decreased venous return sa pasyenteng may angina? Yes! To decrease cardiac workload. To decrease cardiac workload. Major pacemaker ng heart. Sagot? SA. Antidote ng heparin. Ha? Ilang days mag-effect si Coumadin? 2 to 3? 2 to 3. Binibigyan ko ng thrombolytics beyond 6 hours. Common cause of death ng may hypertension. CV, hemorrhagic stroke, bibigyan ko ng anticoagulant. Ano gagawin ko? Craniotomy. Pag may pituitary tumor ako, pwede ako magkaroon ng hypertension? Yes. Okay, ano tawag dun sa tumor sa may adrenal medulla? Pheochromocytoma. Okay. Yan muna, class. Ano muna tayo? Pagti na lang. Okay. Ano na lang tayo? Cardiac dysrhythmia, siguro 1 hour na lang yon. CHF, alam na natin. CHF, cardiac dysrhythmia. Ibigay ko na lang yung notes. At saka yung last na dyan ay yung Raynaud's and... Alam na rin Raynaud's and Burgers, di ba? Saan yung common sa female? Yung cause ay smoking. Common sa male. Bibigyan ng vasodilation. Bibigyan ng vasodilator. Yes, kasi ang pathophysiology ay vasocons. So may necrosis, anong last resort? Oh, perfect na tayo sa last. Peripheral vascular diseases. Okay. Yan tayo, class. Tomorrow, I will not minute more for the budgeting. Pero last na lang tayo, cardiac dysrhythmia. Yung shock na lang. May konti tayong alam na sa shock. Pero discuss lang natin, cardiac dysrhythmia and shock na tayo next meeting. Then before that, quiz muna tayo. Okay? So that's it. Maabot natin yung respiratory, kaya kong i-discuss yan ng 6 hours in a day. So baka meron tayo day na 6 hours, buong 6 hours tayo. Ng November na siguro yun. Quiz natin next week, yung quiz natin. Next week yung quiz natin. Sa lahat ng discuss natin. Ngayon, finals. For your grades, approach lang ako bukas sa office. Anytime naman. Okay, yun lang muna and remind mo ako to send the notes. Baka makalimutan. Okay. Bye.
Bye, sir!